In this video, we will cover progressive patient care. What do you mean by progressive patient care? In this image, the patient is in critical condition. If you look at this image carefully, you can understand that the patient condition improves progressively. It means patient care is the organization of hospital facilities, services and staff as per the medical and nursing needs of the patient. In other words, patients are shifted from unit to unit as the patient condition improves. And that type of organization of patient care is called a progressive patient care. Coming to the basic principles of progressive patient care or PPC. PPC is based on the nursing needs of the patient rather than grouping of patients as per the traditional methods like economic status, age, sex or type of illness. Traditionally, patients are admitted or grouped in hospital based on the economic status, say for example, pay ward or general ward, or based on age like adult ward, pediatric ward, or sex, example, male ward, female ward, or type of illness, TB ward, diarrhea ward, etc. In progressive patient care, patients are admitted based on their nursing needs, not based on this traditional system of grouping. Coming to the origin of this method, the concept of PPC is quite old and started in military hospital and by Florence Nightingale in 1800 AD. The modern application of PPC in hospitals started in 1950s. Progressive patient care has three basic objectives. Number one, provide optimum level of care to various patients. Second, raise the level of patient care as the patient condition deteriorates or improves, utilizing effective nursing personnel and facilities. Third, control the cost at the same time providing nursing care as per the need of the patients. About the elements of PPC, which is the core of progressive patient care. There are 6 elements. Number 1, intensive care, intermediate care, self-care or convalescent care, ambulatory care or OPD care, home care and long-term care. First about intensive care. Here you can see the patients in the intensive unit or critical care unit require close monitoring and the round-the-clock care. Examples are patients with acute MI and fatal arrhythmias. Next is intermediate care. In the intermediate care, there will be patients who are shifted from intensive care unit since their vital signs are stable and there is general condition stabilization. Example of an intermediate care unit is cardiac ward. Here the patients will be shifted from coronary care unit when their vital signs or general condition stabilizes. The third aspect or third element of progressive patient care is self-care. In self-care, patients are taught administration of drugs, lifestyle modification, exercises, ambulation, self-administration of insulin, checking pulse, blood glucose and dietary management so that they are able to care for themselves and they are fit for discharge. Fourth element of PPC is long-term care. In long-term care, there are patients who are chronically ill, disabled and helpless. Nurses and other therapists help the patients and family members. The help include assisting with coping with illness, ambulation, physical therapy and occupational therapy along with activities of daily living. So, these type of patients who are chronically ill, disabled and helpless are cared in these long-term care facilities and they are assisted by, the patients and family members are assisted by nurses and other therapists. Coming to the fifth element, that is home care. Some hospital or centers have home care services. Home care services is a package which consists of staff, equipment and supplies for care of the patient at home. Examples of patients who can be taken care of at home include paralyzed patients, post-operative patients, mentally retarded or spastic patients, and patients on long chemotherapy. The sixth element of PPC is ambulatory care or OPD care. These areas include outpatient departments, clinics, diagnostic centers, and daycare centers. Patients visit these areas for follow-up, diagnostic, curative, rehabilitative, and preventive services. Thus, we complete the six elements of progressive patient care, which are intensive care, intermediate care, self-care, ambulatory care, home care, and long-term care. About the merits of this method. First one is efficient use of personnel. Second, clients are in the best place to receive the care that they require or the care is provided to them according to their need. Thirdly, there is use of nursing skills and expertise at the maximum. Fourth, clients are moved towards self-care as their independence is fostered. There is efficient use and placement of equipments. And last advantage is personnel have greater probability to function towards their fullest capacity according to the patient's requirement. About the demerits of this method, number one, there may be discomfort to the patients as they are moved down to other units as their condition improves. There is continuity of care difficulty. Long-term nurse-client relationship is not possible or it is difficult to arrange. Great emphasis is placed on comprehensive written care plan. We have already told that as the patient condition improves, he will be shifted to next area of care. For example, from intensive care to intermediate care. So, to shift the patient like this from one area to the other, there is written criteria. Another disadvantage is difficulty in meeting administrative need of the organization, staffing evaluation and accreditation. To summarize this topic, progressive patient care is nothing but organization of care as per the need of the patient, and there are six core elements, namely intensive care, intermediate care, OPD care, self-care, home care and long-term care. Here is the end of this session. Thanks for watching.